Hi, I'm Tara Schmidlin, the CPMC genetic counselor. Before you view your results, I want to give you some information about what the results can and cannot tell you. When viewing your results for any condition, it is important to remember that the testing done as part of the CPMC study only looks at disease risk. CPMC test results are not a medical diagnosis. Obesity is defined as the excessive storage of body fat. Being obese increases your risk for other serious health problems like heart disease, high blood pressure, and diabetes. Obesity occurs when more calories are consumed than are burned through exercise and normal daily activities. The extra calories are stored by the body as fat. Fortunately, even modest weight loss can prevent the development of health problems associated with obesity. Many people are able to successfully lose weight by changing behaviors like increasing the amount of exercise and making healthier diet choices. In the United States, more than 1/3 of all adults are obese. Obesity is more common among females than males, and the risk of becoming obese increases with age. Other risk factors that can contribute to the risk of becoming obese include genetics, age, lack of physical activity, sitting while watching television, unhealthy diet and eating habits, family history, lack of sleep, taking certain medications like antidepressants, seizure medications, antihistamines, diabetes drugs, steroids, and beta blockers. Additionally, some people may become obese after quitting smoking, and some women may become obese following a pregnancy. We mentioned that genetics are a risk factor for obesity. The majority of obesity cases are caused by a combination of multiple genes, lifestyle factors, and the environment. It is estimated that about 86% of the risk of obesity in the Caucasian population is due to differences in genetic risk factors, while the remaining 14% of the risk is due to differences in non-genetic risk factors like diet and exercise. It is not possible for obesity to be diagnosed by genetic testing. Obesity is diagnosed when a person's body mass index is 30 or higher. A doctor may also ask questions about your health history, measure your waist circumference, conduct a physical exam, and order blood and heart tests to determine if you are at risk for any complications of obesity. Body mass index is a common measurement used to estimate a healthy body weight based on how tall a person is. Body mass index is calculated by dividing weight in kilograms by height in meters squared. Although body mass index is often used to categorize weight class, it may misclassify individuals who have significant muscle mass as overweight or obese because BMI does not distinguish between body fat and muscle mass. The table shows the different weight classifications used by healthcare providers based on the calculation of body mass index. Individuals who are obese are at risk of developing a number of other health conditions, including type 2 diabetes, high blood pressure, high cholesterol, and high triglycerides, also known as metabolic syndrome, heart disease, stroke, cancer, osteoarthritis, depression, among many others. In addition to adversely impacting your physical health, obesity can also take a toll on your mental health and overall quality of life. Consistently employing the following strategies can help prevent weight gain that can lead to obesity. Make regular exercise a priority. Eat a low-calorie, nutrient-dense diet. Weigh yourself weekly. And keep a food diary to help you know and avoid the trends or patterns that cause you to overeat or make poor food choices. Now let's talk specifically about the CPMC results and genetic risks for obesity. Studies have shown that a particular genetic variant called RS9939609 is associated with an increased risk for becoming obese in people who have 1 or 2 copies of this variant. This variant is relatively common in the general population. About 63% of the Caucasian population has at least 1 copy of the risk variant. Remember that we all have 2 copies of every gene. We inherit 1 copy from our mother and 1 copy from our father. This means that for every genetic variant the CPMC study looks at, you can have either 0, 1, or 2 copies. Your CPMC results will tell you how many copies of this risk variant you have. Your obesity results tell you about the impact of a risk variant on your risk to become obese. Having 1 or 2 copies of this risk variant increases your risk of becoming obese compared to people who have 2 copies of the non-risk variant. Having 2 copies of a non-risk genetic variant means that your risk to become obese is lower compared to people who have 1 or 2 copies of the risk variant. Remember, obesity is a complex condition, which means that it is caused by a combination of variants in multiple genes and the environment. No single genetic variant causes obesity, so no single genetic variant will completely predict your risk for becoming obese. Results of CPMC testing alone do not diagnose obesity or rule out the chance of becoming obese in the future. Genetic variant information can help estimate your risk of obesity. However, other risk factors, like your family history or lifestyle, may have a greater impact on your risk than any individual genetic variant. We may learn of other genetic variants that influence your risk of becoming obese in the future. As we learn more, your estimated genetic risk for obesity may change. We'll keep you updated on any changes through the CPMC web portal. For more information, consider sharing your CPMC results with your healthcare provider. You can also contact a CPMC genetic counselor, read information on the CPMC health condition page, or attend a CPMC educational event.